We are live. Hello, everyone. Dr. Waltzman here. For anyone that's new to our channel or our Instagram feed, my name is Dr. Josh Waltzman. I'm a board-certified plastic surgeon here in Long Beach, California. Today, our topic for our live session is going to be on breast implants. Looks like some people are going to be hopefully joining in a few minutes. And so we'll just kind of get into stuff. But the goal of today's session really is just to give an overview of all things breast related, focusing mostly on breast implants, silicone versus saline, smooth versus textured, what the consultation process is like in my office for patients, and some of the tools that we use to help patients figure out what size or type of breast implant is going to work best for them. We'll also talk about when do you need a lift, if you even do, what are some of the indications, and who is the best patient to benefit from a breast lift, maybe in addition to breast implants, or maybe even on its own. And then there is a topic called ALCL, which we might get to at the end of today's live session. If we run out of time, we can talk a lot more about that in a future session. So hi, it looks like we have some people joining. Again, we were just kind of going over the rundown overview for today's live session on breast implants and all things kind of breast related. So let's kind of just jump into it now. Looks like we have enough of a quorum to start. So breast augmentation, I'm just going to kind of tell you what I tell patients in the office when they come to see me for a breast augmentation consultation. I tell them that breast augmentation is a great procedure to make you a bigger version of what you are. So, or whatever your breasts are. So if your breasts are wide apart on your chest and you have a lot of cleavage, you're still going to probably have that same amount of cleavage, and your breasts will still be spaced fairly wide on your chest after augmentation. On the flip side, if your breasts are very close together and your breasts almost touch, meaning that you have very narrow cleavage, then you'll probably still continue to have that afterwards. So in essence, it really does just make you a larger version of what you are, unless you're doing some other procedure in addition to an augmentation alone. So augmentation comes in two different flavors of implants, as I like to say. So there's silicone and saline implants. Those are the two general categories of implants that we have. And I'm only going to be talking about products that are FDA approved in the United States for use. There are other products that have clearance in Europe and whatnot, but I won't really get into those for today's discussion. Just focus on the stuff that's already approved here. So silicone and saline, the most common. I would say in my practice, probably about 98% of the breast surgeries and breast implant augmentation surgeries that I do are with silicone implants. There is still a time and place for use of saline implants, but most of my patients in my hands elect and choose silicone implants. So what does that mean? So whether you're using a silicone or a saline implant, the shell, the outside of the implant, is essentially the same. So this is a silicone gel-filled implant. The outside of it is a silicone shell, which is the part that actually touches any part of your body or your tissues. Now, whether you use a saline-filled implant or a silicone-filled implant, there's still a silicone shell that's going to be in contact with your body. So that part doesn't change. The differentiator between silicone and saline implants is the filling. So this implant is a silicone gel implant, which means it's a silicone shell with a cohesive silicone filling, and we'll get into what that means. A saline implant would look similar, except that the filling on the saline implant would be salt water or saline. There are pros and cons for each. For most patients, like I said in my practice, elect for a silicone-filled implant. I think overall silicone gives a softer feeling breast, perhaps more lifelike, with less rippling potentially with some of the newer highly cohesive silicone gels. Saline is a great option for some patients. The downsides to saline would be that if it ruptures, you're going to see it go away in about 24 hours, which could also be a positive for some patients. Saline also may have a little more rippling around the edges, visible rippling, which some patients are bothered by, and doesn't look as natural. But they both can give a very, very beautiful appearing breast, whether you use silicone or saline. Hi everyone that's kind of joining in there. Give you all a wave back. So let's see. like I was saying, silicone versus saline, they both have their pros and cons. Most of my patients are using silicone, and I mentioned that they have a highly cohesive gel filling. So the gel has kind of evolved over the years and over the decades to the point now where it's almost a solid. So the latest generation of silicone implants, which is really all that I use in my practice, is that kind of, quote, like the gummy bear type of breast implant. And what gummy bear kind of is more of a popular term now for a highly cohesive implant. What it means is if you were to take an implant like this silicone filled implant and slice it down the middle, you'd pretty much just be holding two pieces of an implant. You could kind of shake it, and nothing's going to spill out. It feels almost like liquid inside of here, but really it's almost a solid type of substance. Which means that it's extremely safe. If there is a small rupture inside of your body, it's not all of a sudden going to start pouring out and going everywhere. It really stays very well contained within that capsule or within that shell around the implant. So this was something we just did here in the office to demonstrate. But what I did was I made a little cut in the top of this implant, and just to demonstrate the type of silicone. So you can see if I squeeze, that's the silicone gel bulging out there. And as soon as I let go, it just sucks right back into the hole that I made. If I go like this and turn it upside down, it's not going anywhere. See, it's just bulged out right there, but that's it. And as soon as I let go, that silicone is just going to suck right back in. So that makes for a very safe type of product. Obviously, you wouldn't have that happen to your implant. You wouldn't be doing that, but that was just for demonstration for here in the office. So that's kind of the main difference, silicone versus saline. I don't have an example of a saline implant to show you because it actually doesn't keep very well. If it just in room air, some of that starts to evaporate. So I don't have a saline to show you, but it would look similar except kind of have a different feel to it with water inside. If anyone has questions along the way, please don't hesitate to throw some stuff out there. The next kind of topic I wanted to get into was smooth versus textured implants. And this is something that's been in the media quite a bit. Smooth versus textured. And what this refers to is the outer coating of the implant. So the implant that I was showing you before, like these two implants here, these are smooth implants. They have a smooth coating that is just a kind of a slick outer shell, just like that, okay, filled with silicone, in contrast to a textured implant, which looks like this, okay? So you can see if the two are together, there's an obvious difference between the two implants here. This one is smooth and this one here is textured, and it feels a little bit more like, it's not as rough as Velcro, but there's definitely a textured feel to the implant. And they have their obvious, they look differently to the naked eye here. Pros and cons of smooth versus textured. So this is an issue that gets debated quite a bit, excuse me, that gets debated quite a bit amongst plastic surgeons. Smooth versus textured. For most patients, a round smooth implant is going to be the way to go. You're probably not going to notice any difference in the way the final outcome is, and it will give a very nicely shaped, beautiful breast. The place where round, so this is a round implant, same on all sides. Textured round implants, okay, are useful sometimes for patients when you need to better control the pocket, you need to make sure the implant isn't going to be sliding too far out to the sides, and you can help kind of lock things in better. The kind of Velcro property on the outside of that implant is going to help kind of secure it more within the pocket. Patients can't feel the difference. So whether there's a smoother or textured implant inside of someone and you feel their breast or they feel their own breast, they would never be able to tell that difference in what the texture or smooth surface was like. The other indication for using a textured implant is if we're going to get into shaped implants. So a shaped implant looks like this from the front, so it looks round from the front essentially, but if you turn it to the side, you can see it actually has a shape to it, kind of like a teardrop. So this would be the chest, and this would be kind of where the nipple sits, and you can see there's a shape to it. If you turn it upside down, there's an upside down breast, okay? So it really does hold its shape very well. And this is one of the highly cohesive types of silicone implants. Contrast that with a round implant like this one. If you hold it from the front, they're both round. If you turn it to the side, that's where some of the differences start to appear. You're going to notice more rippling on the round implant. But what you notice also is that it's almost taking on the appearance of a teardrop, especially once it's inside the body, try to simulate this. Once it's inside your body, this hand here would simulate like your chest muscle pushing down on the implant, and it kind of takes on a teardrop shape anyway, okay? The benefit to a round can be that if it rotates in your body, it's still going to be the same. It doesn't matter whether it's upside down or right side up, because there is no top and bottom to it. There's a front and a back, but there is no top and bottom. Contrast that with a textured or a anatomic or a teardrop implant, that if that thing turns over upside down, it's going to obviously look kind of misshapen inside the body, and the only way to really go back there and correct that is you need surgery to actually reorient the implant and make it straight again in the body. Now, that's not so common, okay, but it does mean that the surgeon has to be a little more precise in dissecting the pocket, or like the home inside the breast where the implant's going to sit, because if you make too big of a pocket for it, it's going to have a much easier time rotating around versus if it's really snug and tight within that pocket. So in my practice, the only time I really, for the most part, use a textured implant is if I'm putting in a shaped or a teardrop implant. And one question that comes up is, are all shaped implants textured? The answer is yes, they are all textured to some degree, because if it was smooth like this, then it's gonna have a really easy time rotating. And if this was smooth, it would just flip like this all the time, and you'd constantly have an upside down shaped breast, which is not an ideal thing. Hi everyone who's just kind of joining. So just to kind of review, because we have had some new people join into the feed, we are talking about breast augmentation stuff today, and kind of all things breast related. We started talking about silicone versus saline. We are kind of moving on to the smooth versus textured conversation, smooth implants versus textured implants. Soon we're going to start talking about the consultation process in our office and what that's like, and some of the tools that we use to help patients figure out what size implant's going to be right for them or what surgery is going to be best for them. We'll talk about a little bit about breast lifting with and without implants, and kind of wrap it up, I think, at that point. So where we left off, hi everyone who's joining. Glad to have you all here. This is a really good conversation, I think, for general information on breast implants. So we were talking about smooth versus textured, and that all anatomic or shaped implants like this one have to be textured, otherwise they would spin around a lot. Other question is, people wonder, like, does it matter? Can you even tell if someone has Team Silicone? I like that. We should have a face-off, Team Silicone versus Team Saline. So people ask, can you tell the difference between a shaped implant and a round implant? Again, this is something that is debated by plastic surgeons every year at our annual meetings. And it's a topic that I'll just give you my impression on. Doesn't mean that it's the correct one, but it's kind of my take on this topic. Is that for the average patient, you're never going to know the difference. They've done some studies asking plastic surgeons to look at a picture of a patient before and after and say, does this patient have a shaped implant, like a teardrop implant, or a round implant? And plastic surgeons, who you would assume we know what we're looking at, got it right less than half the time. So that tells you there probably really is no observable difference in reality. Now, so in my practice, for most patients, I do recommend sticking with the round, smooth silicone, just because you don't run that risk of having issues with the implant rotating or moving around on you. So that's for most patients. However, the times when I feel that a textured shaped implant can be really beneficial to a patient is if the patient has very little breast tissue, and they want a very natural appearing breast. So small breasted women, we're talking like A cup or minus A cup, who want a very natural appearing breast, are oftentimes good candidates for a shaped implant, because the shape of the implant is going to become the shape of your breast. And if you have very little breast tissue to camouflage that, you're going to end up seeing more of a round shape. Now, some people want that round appearing breast, and so in that case, if they don't have a lot of breast tissue but they want kind of that augmented look, a high profile or moderate plus profile round is going to be the way to go. But if someone doesn't have a lot of breast tissue and they want to maintain a very nice natural slope to the breast, a shaped implant can oftentimes be a good option. Question, so is there a chance a textured implant can still rotate? Yes, and it does happen. So when we're dissecting out the pocket for a textured implant, we have to make the pocket or the home that we create for the implant have to be very, very tight and snug so that it locks in like Velcro from day one. If it's too big, you're going to get some rotation. Now, if it starts off like this, and that's what that line is for us, as we're putting it in to make sure that line is straight up and down, if it does rotate a little bit, probably not a big deal. And probably a lot of women have slight rotation of their implant, but it's not noticeable. But if this thing goes 90 degrees, that's a problem, and it can happen. And the way to fix that is you have to go in, take out the implant, tighten down the pocket surgically, and then put the implant back in there and hope that it doesn't rotate again. Is there a minus A cup? I don't know. There probably is. I just made it up. Patients tell me they have a minus A cup, so I guess it must be a real thing. Hi, Dr. Pat Basil, joining us from Florida. Glad to have you here. So that's kind of the overview of shaped implants. The other time we use shaped implants like this can be for breast reconstruction. Again, because those women don't have a breast to start with, and whatever you put in is going to be the shape of their breast. I didn't mention at the beginning that a component of my practice is also doing breast reconstruction for cancer patients. And so when we're doing that, we have to think of a whole nother area of plastic surgery to reconstruct a breast mound from nothing. But today, like I was saying, most of our conversations will be more cosmetically focused, not reconstruction focused. So that's kind of smooth and textured. Any other, let's see, question here. Is a textured implant typically cheaper? The textured implant is typically more expensive. So yeah, there is a little bit of a price premium for a shaped implant. Now, a textured round implant is actually the same price as a smooth round. But once you get into the anatomic or the teardrop shaped implants, there is a price premium for that of a couple $100, I think, per implant. Let's see, what other questions here? Do I recommend shaped implants often? I would say it's less than 25% of the time in my practice. Like I said, this is a highly controversial topic amongst plastic surgeons about is shaped or round better. It's a matter of personal preference. Like I was saying, oftentimes you can't tell whether a patient has a shaped or a round implant unless those two exceptions, unless it's breast reconstruction potentially, or if someone has a very, very small amount of breast tissue to start, maybe that person would be a better candidate for an anatomic implant, in my opinion. That's my disclaimer, in my opinion. Let's see, do you recommend textured for a weight loss patient? So it depends on the quality of skin for a weight loss patient, actually. That's one indication where sometimes a round textured implant can be useful because it is going to sit better in that pocket and can sometimes be a more stable, quote, stable breast implant. And so it depends on the patient's tissue quality if I would recommend a textured implant over a smooth implant in those cases. So that kind of requires to see someone in the office and kind of feel their skin to see how much extra skin they're left with and how lax or how much laxity that pocket has. How long do implants last? That's a great question. So implants last a long time. I know that's kind of a vague way of answering that question. They're not meant to last a lifetime. These are man-made devices. They are prone. They can fail like any man-made device. They're not meant to last your entire life, but they last a long time. So just based on the data, and this is stuff that I tell all my patients in the office during our consultation, if you just look at the data for breast implants, women with breast implants do something, and something is a pretty broadly defined term, about every 10 to 15 years. Now, that doesn't mean that they have to do something every 15 years. I see a lot of patients who've had implants for 20, 25 years, and they look and feel great. And I wouldn't necessarily recommend that patient all of a sudden just have surgery for the heck of it because it's been over 10 years. But if you look at the data, on average, women do something every 10 to 15 years. And the reasons they would do something is perhaps to change the size. So they started off smaller, perhaps they want to go larger. Maybe they were larger and now they want to downsize their implants. Maybe a new implant came out that's supposed to feel more natural and you want to do an implant exchange to the newer style. That's a good reason. Or perhaps you just want the implants out. That's a common scenario as women age and they've had their implants for X number of years. They have gotten their money's worth, they've had their fun with them, and they want them out now. And so we can just take them out. Hello to people that are just joining. We're talking about reasons that somebody would have surgery after having breast implants placed. And so I was saying the reasons would be to change the size, to get a newer style implant, to take them out completely is an option, or if there's an issue. So some of the issues might be capsular contracture. So that would be hardening or thickening of that scar tissue around the implant itself. Or if there's a problem with the implant, like it has a rupture, like a small little tear in the surface of the implant, that would be a reason, if you found that, to have your implants removed or exchanged or something like that. One thing I should mention about implant rupture, because I did mention it, the word rupture makes it sound like something exploded in the breast, and this could not be further from the truth for most patients. A rupture could just be a little tiny tear, even like 5 millimeters, a tiny little tear in the surface of the implant. That is the same type of rupture. It's still called a rupture, whether you have a tiny little poke or if the whole thing is cut in half. That's still called a rupture. So it's not like anything explodes or that silicone goes everywhere. You could have a small rupture and that silicone gel, like I showed you on this implant here, all that gel could still be sitting right within the implant, but technically, yes, it's ruptured. So I just wanted to clarify that point if anyone was wondering. Let's see, there were a couple questions back here. Is it very difficult to fix implants that fall into the armpit when laying down? Right, so what that means is, let's see, how do we get that screen to go back down there? There we go. So if an implant is falling into the sides of the breast when you lay down, it means the pocket is stretched over time. That can happen either because the initial pocket was dissected too big by the surgeon, it was dissected too far out to the side and the implant's just kind of sloshing around, or over time, heavy implants, especially large saline implants, can stretch the skin quite a bit. And the solution for that, for many women, is taking out the implant and tightening down the pocket. Sometimes women need a lift or to remove some skin at the same time, or it's just a matter of sewing down or tightening up that pocket on the side to pull the implant back onto the chest. So there are definitely solutions for that. It's a common procedure that we do, especially for women that have had implants for a long time. It can be a pretty extensive procedure sometimes, depending on how big of a pocket is created in there, but definitely something that can be addressed. Let's see. Hi, everyone that's been joining. Let's see. We're scanning up to more questions here. What is recovery time? How long would I have to take off work? That's a great question. So, yes, this is an outpatient surgery. That was one of the questions. We'll just hit that. So it's an outpatient surgery. Surgery time takes under an hour to do, but I tell patients expect from the time that you leave the pre-op area where you're getting your IV and having your markings done until the time you get back to the recovery room, somewhere between an hour to an hour and a half max. But the actual, me doing the surgery part is less than an hour for the vast majority of patients who are just having breast augmentation alone. Then you go home after recovering in the surgery center for about an hour to an hour and a half. You go home then. I give every patient a call that evening to check up on them, make sure they're doing okay their first evening at home. You should be at the dinner table having dinner with your family or whoever you're living with. You should not be laid up in bed for weeks on end with this procedure. Yes, you are sore. There is some tightness. It feels like you've done a lot of push-ups and your chest muscles are sore. Recovery time. Most patients, like the vast majority of patients, only take pain medication for maybe 2 to 3 days, if that, and then they're just taking occasional Tylenol or Advil. But really, it's the discomfort or tightness dissipates pretty quickly after this procedure. My restriction, and again, this varies by doctor, so you have to follow your own surgeon's instructions. Don't listen to me if I'm not your surgeon. And don't go on Google and look at someone else's post-op instructions because we all have different protocols. But for me, it's 4 weeks of kind of R&R. So rest and relaxation for the upper body, no upper body workouts for 4 weeks, no strenuous lifting or repetitive motions. You just need 4 weeks, in my opinion, to let your chest heal and let some of that initial scar tissue start to form and let the swelling go down. So 1 month, you can resume most upper body activities, and I usually release patients after I see them in the office for their 1 month follow-up. How long is take off work? I think that's highly variable. So if someone has a desk job, I've done surgery on patients on a Thursday, and they take off Thursday, Friday, and then Saturday, Sunday's the weekend, and they go back to their desk job on Monday. But if someone has a physical job, they're in their car all day making sales calls, or they're working in a warehouse, or they have lifting heavy boxes all day long, then I think you really do need to take off a couple weeks or be on some type of modified duty, just because it's just not a good way to recover. The muscles don't have time to relax. You're going to have swelling that's going to persist for a longer period of time. So really, I think, if it's a more strenuous job like that, taking a couple weeks off is really in your best interest. When I see patients back at 3 months, I would say like 99.9% are pretty much back to full activity, doing everything they were doing before surgery. Even by 6 weeks, a lot of patients are doing most activities again. But really that first month, I think, is the most critical. Let's see what other questions. These are all great questions. Is this outpatient surgery? Yes, definitely outpatient surgery. Let's see. Can't wait to have my in-person consult. Oh, we can't wait to see you. That's one of the sad parts about this coronavirus isolation, is that we've been doing a lot of virtual consultations for patients through telemedicine, and we have patients who just can't wait to meet us in person, and we can't wait to meet them as well. Let's see what this question is. Does a lift without implants have the same recovery time? A lift alone, that's a good question. A lift alone is very different than doing an augmentation. So most of the augmentation I've been speaking about during this session, I'm talking about doing under the muscle or a dual plane breast augmentation, which means the top half or so of the implant's under your muscle, and the bottom kind of portion of the implant is not under the muscle, it's just under the breast tissue. That's a very different type of recovery and procedure than doing a breast lift alone. A breast lift alone, although not our topic, I'll just touch on it briefly. A breast lift alone is a procedure that only operates pretty much on the skin and the fat or the glandular tissue of the breast. There's no muscle involved in a breast lift. So the recovery is different. You don't have that muscular pain. You have what's called more incisional pain, which is kind of a dull background, kind of aching or burning type sensation around the incisions. Still, I do recommend patients refrain from upper body workouts for about 4 weeks after a breast lift alone. And that's really more for the incisions to heal. Because if you have an incision that kind of goes in it like an anchor around the areola, straight down and under the breast, and you're moving your arm like this all day long, that's going to put a lot of tension on that incision. And so I think just to play it safe and not risk the chance of having complications, it's better, again, just to refrain from that upper body workout stuff for about 4 weeks. And then for most patients, you're good to go after that. They've had a chance to heal. For all incisions, like this is just a side note, it's 6 weeks after surgery, an incision has about 80% of the strength of normal skin. So if that kind of gives you any indication of how long it takes for our skin to repair and heal, that's just kind of a good general guideline that you're still not quite back to your full strength even at 6 weeks, but you can start doing definitely some more activity. Okay, so that's smooth versus textured. The next thing I wanted to kind of touch on was our office consultation process for breast augmentation. So when patients come in to our office, they're greeted by our patient care coordinator. They're brought back to a room to discuss kind of what their interests are. And then, you're welcome so much. The questions are great. I'm happy to answer questions. So they're brought back by the coordinator, and then at a certain point, I come in to talk to the patient more about their medical and surgical history, do a full history. Then we step out, have patients change into a gown, and then we come back and I do a full physical exam, taking full breast measurements, examining the skin quality and the breast tissue at the same time. And then once we have all of our measurements, we can start talking about what procedures would be recommended, whether it's a lift alone, whether it's whether it's augmentation alone, whether it's a lift alone, or whether it's potentially a lift with implants. Those are all different things that can come up. One of the first things we do after taking the measurements is we have this device in our office. It's a 3D simulation program called Chrysalix, and it's iPad based. So we use the iPad, and this is a 3D scanner bar that's mounted on the top of the iPad. And I will hold the iPad like this, and patients will stand in front of the background, and I'll basically scan around their whole body, their upper body, to create a 3D simulation of their breasts. And then that gets processed in the iPad. It takes about 30 seconds, and we have a full 3D simulation of the patient that we can manipulate. So without showing any nudity and keeping it kind of G-rated, this is what it ends up looking like. Kind of show you here. So this is a simulation of one of our patients. There's nothing identifying here, and I have right now I have a top on this patient so that obviously there's no nudity, but putting clothing on is something optional, obviously. And then so right now you can see this is the patient currently, and this is the patient after we've done a simulation. And the cool thing about this is that you can rotate in real time and show them how they would look. Obviously without clothing, but for this we're just going to leave the clothing on. And you can see here is before, here is afterwards, and we can change the size based on their measurements and based on their preferences. And we have a pretty accurate 3D model of how they would look. I think the 3/4 view is really helpful. The other really nice view in this program is that we can do this view. So this is how women see the world when you look down at yourself. And so this is extremely helpful. Looking down without implants and looking down at yourself with implants can make a huge difference. And so we use this as part of almost every single consultation process, this program called Chrysalix. And patients can either upload pictures at home to me beforehand, and I can actually start looking at their images of their breasts and doing simulations before they ever get to my office, or we can do it in the office, and it takes, like I said, it's just a minute to scan them, and it generates this in real time. The other kind of cool feature of this program is that there are 3D goggles, so you can do VR, virtual reality goggles, and put on the goggles in office, and then you're in a virtual environment, and you can look around, and you're in a room, and you can see your 3D simulation you can see it from the side, you can look down, you can see yourself down, you can look in all different directions and see yourself in the mirror with your larger enhanced breasts. So it's a really, really good tool to kind of give patients an idea of what they're potentially going to look like. Now, obviously it's a simulation, it's not reality, but it's a really good tool. And not only does it help for patients just to kind of see how they would look, because they can see themselves with their own freckles and their own birthmarks or tattoos or whatever it is, but also it helps me as your surgeon to kind of find out what you're looking for. Because when someone says, oh, I want to look natural, okay, so that's really a broad term. So what's natural to the patient may not be anything natural that I consider. And so doing some type of simulation like this really helped me kind of get inside the patient's head to find out what they're looking for and what they find to be attractive. So that's the first thing that we do. And then, I should mention, once that's completed, we save the simulations. And we can do a couple different versions, like almost like a small, medium, and large version if a patient doesn't know exactly what kind of size range they're interested in. And then I can go back, and after the patient leaves, we can email them a link to their simulations, and they can go on at home and open up their simulations and spin it around in 3D. They can try different clothing on. They can show their significant other or whoever else they want the opinion of how their new breasts look, and they can kind of go that way, and it works really, really well. Hi, everyone that's kind of new and just joining us. So for those who are new, my name is Dr. Josh Waltzman. I'm a board-certified plastic surgeon in Long Beach, California. We're talking about kind of all things breast implant related today. We just finished up kind of showing our 3D simulation software that we use in the office that does a real-time simulation of breast implants. We email it to patients afterwards so they can go on and log in and see how their new breasts would look. And that's a really useful tool. The other thing we do, so most of my planning for implant size, a lot of it is based on the patient's own tissue breast measurements. And so what may have looked good on someone else isn't what's going to look good on that particular person. Or if a patient comes in and shows me a picture from my website and says, oh, this person had 420 cc implants, I like the way they look, that's what I want. It's really hard to do that for a patient because everyone's measurements are different. And so you really have to go for more of a look or a volume that you're trying to create and not worry so much about what the number of cc's are in the implant. Worry more about how you look and feel in clothing. I think that's going to make patients much happier in the end than saying, oh, my friend had 500 cc's, her breasts look great, I want 500 cc's. There's so many variables in that equation. So try to avoid the cc conversation and talk more about volume and cups, not really cup size, but more like volume and how you look and feel. The other really cool thing that we do in the office, after we do the exam, take the measurements, do the Chrysalix 3D simulation, is then I have patients try on a sizing bra. So a sizing bra with sizing implants is this. So these are preformed kind of breast implant inserts that have the same volume as a round implant. Like this one says 150 cc's on the back. It's still 150 cc's of volume, but now this is shaped like a breast and it actually has a cutout. So patients would put on like a sports bra like a sizing bra that we have here in the office, and then put these inserts on either side inside the bra. So like this one is like 250 and this is 150, and they come in all different sizes from like 50 cc's all the way up to, I think like 650 is the biggest or something like that. And you can stack them up too. So we can make all different sizes by just stacking these inside of a patient's bra. And then they have a really, really good idea. And they can put their own clothing on in the office. And that gives them a really good idea of how they're going to look with that much volume. And so between those three things, our exam, the chrysalic simulation, and then the patients putting on these sizing bras and seeing how it actually looks and feels, my patients have a really, really good idea of what their expected outcome is going to be. So it is not often at all that one of my patients will come back and say, oh, this is the size we talked about, but I'm really not happy with it. I thought I was going to be a lot bigger. I just don't hear that because we have so many new ways with technology and the sizers to just get it right with patients the first time. And they totally know what they're getting into and how much volume they're going to have after surgery. So that's kind of how we do the process in the office. Any questions about kind of the office experience or sizing, how we pick sizes for patients? No, not right now. Okay. If you think of something, just jump in. The last kind of portions that I wanted to talk about before we wrap stuff up for today is how do you know when you need a lift? So this is a big topic, and I can't spend like an hour. Maybe we'll do another topic just on breast implants with lift alone. But patients who need a lift are patients that have what's called breastosis. So ptosis means sagging or hanging, and it's all in relation to nipple position. So oftentimes, if the nipple position is significantly below the level of the breast fold, like if you put your hand under your breast and feel where the breast fold is, if your nipple is sitting lower than that, chances are you are probably going to need some type of lifting procedure to elevate the position of the nipple back up higher on your chest. Ideally, and this is another personal preference thing, but ideally you kind of want the nipple sitting kind of on the center or the most projecting portion of the implant. That's the right way to say it, is the most projecting portion of the implant. If the nipple is sitting too low, it gives a very odd shaped breast. It kind of looks like the breast is sliding down and you have all this nice fullness and you have the nipple that's sitting down here on the breast. And if that happens, it just doesn't aesthetically look like a very nicely shaped or proportioned breast. So the easiest way to know if you're going to need a lift is if your nipple's pointing down already. Yes, you're probably going to need some type of lift, but it's a case-by-case basis. Sometimes there's patients who are kind of borderline, and just putting in a nice full implant can volumize the breast enough that it's not so deflated, and then the nipple ends up being in a pretty good position. But that's something that you can't just make a blanket statement for. You have to really see the patient to understand what they're looking for, to see if they might be able to get by without a formal breast lift. But putting in implants is never the same as doing a breast lift for someone. I never tell patients they're going to get a breast lift by just putting in an implant alone, but sometimes it can kind of give a little bit of push or rotation of the nipple for patients who are like super borderline. I think that's where you can kind of get by a little bit. But a breast lifting procedure is one that is meant purely to elevate the nipple position and remove excess skin, to tighten up the skin envelope and reposition the nipple to a more youthful place. A lift does not make the breast smaller unless you want to, and then it's called a reduction. But a lift alone is a procedure to just elevate nipple position to get it sitting better on the implant. Now, sometimes you can do a lift at the same time as implants, and other times you have to stage it. And again, this is a topic that gets highly debated by plastic surgeons, so I'm just going to share with you my approach. Doesn't mean it's the only approach, but it's just what I do because I know it's safe in my hands. Hi, ABM. Glad to have you here. So if a patient needs a lift, I kind of first have to ask myself, what is their skin quality? If someone's skin is really, really deflated, like really stretched out with stretch marks, and the breasts are almost like just skin, basically, then that patient, in my mind, their skin is already kind of stretched beyond, and they will probably need some type of staged procedure, meaning that I would much rather get rid of all the excess skin, tighten up the breast, get the nipple higher on the chest, let them recover from a lift, and then about 3 months later, go back and put in an implant. And again, this is my approach. This is not everyone's approach. But it's a very safe, very predictable way of doing that. Now, if someone has just a small amount of breastosis, or the nipple is slightly low and they're looking for a modest increase in size, maybe between 1 and 2 cup sizes fuller, just to restore some volume that they maybe lost after pregnancy and breastfeeding, that patient's probably a much better candidate in my hands for doing a single stage or a combined lift with implants at the same time. The The risks of combining those procedures are the following. So if you're putting in an implant that's going to put more force on the skin and start pushing on the tissues, and then you're going to do a lift, which is going to tighten the skin and put incisions over more of the breast, and if it gets too tight, you could have some issues. You could have problems where parts of the incision kind of start to split open. You could have issues where the nipple or the areola doesn't have enough blood supply, and it could start to die in parts or come apart. Parts of the you could have one implant that sits too high and the other one sits too low. These are all potential complications when you're combining these two procedures in one, because really it is two. One, the augmentation is making things bigger and kind of adding more gravity to the breast, and then the lift procedure is really going against gravity and you're pulling things up. So you have one weighing down, one going up, and somewhere in the middle those two procedures have to balance out. And oftentimes we get it right and it works out well, but probably 10 to 15% of the time a patient requires some type of revision to make things look more symmetric or balanced. That could be as small as just doing a little nip or tuck in the office, or it could mean going back to the operating room to really do a full revision on something that didn't settle the way we thought it would. Conversely, staging it, doing a lift first, letting a patient heal, and then going back and putting in an implant, it's a little more predictable, but yes, it is putting the patient through a guaranteed 2 surgeries. There's no question about that. They're going to have 2 surgeries in that case. And for some patients, that's the only option I give if I don't think they're a good candidate for a single stage procedure. But other patients, yes, we combine them with fairly often and have good results. So it can be done either way. It just depends on what your overall size goals are and your skin quality. That's kind of the 2 things in my mind. And also how much ptosis or how much lifting the patient's going to need. The more lifting, the higher likelihood that I would recommend that we stage those procedures. But again, this is something that's contested with between plastic surgeons. It just depends on comfort level. Let's see. Going to some questions. How does a scar look on a lift? So depending on how much lift a person needs, that will dictate how much scar the person is going to need. So a small amount of lift may only be an incision around the areola, okay, so a circumareolar scar. As you start needing more lifting of that nipple, that circle then becomes like the lollipop. So it's a circle with a line going straight down. And as more and more lifting or more excess skin has to be removed, then that lollipop becomes that anchor where it's around the areola, straight down, and then under the breastfold like an anchor. And that anchor doesn't have to be the whole way under. It could just be a small little portion like this tucked in the bottom of the breast. But that depends on how much lifting you need. Can breast sag again after a lift of? Yes, breast can sag again after a lift. You're turning the clock back, but you're not stopping the clock. So gravity is going to unfortunately keep working away at our breasts. It's not the most common procedure to relift a breast, but yes, as people age, they will continue to that skin will continue to age. How come more surgeons don't recommend splitting up the procedure? I think it's highly variable. I think, if you want to minimize your complications, there's pretty good published data out there now in our professional journals about patients that are higher risk for having complications with combining the 2 procedures. And if someone always combines them, I guess they just get lucky more often than I do. Or they're just willing to accept that a certain amount of the time they're going to have to take the patient back to the operating room for a second procedure. But with my comfort level, I like to be able to sleep at night, so I don't like to push the limits that much. And so I like to just stay on the safe side for what I know is going to work the vast majority of the time for patients. Do you recommend fat transfer with your breast augmentation? What are the benefits? So fat transfer is a really, really useful adjunct or additional procedure that can be combined with breast augmentation. It's kind of like a hybrid procedure. So if somebody wants to use their own fat for a, quote, natural breast augmentation, that's definitely an option. You have to have a donor site, so you have to have a little bit of extra fat somewhere else on your body. Most Americans do have a little bit of fat somewhere on their body that we can steal from. So whether it's your abdomen or your inner thighs or the flanks or some other area on your body that you wanted a little bit of liposuction, we can definitely take that fat, process it, and then inject it back into the breasts. You have to be careful how much you inject at one time. You don't want to get the breast too tight with fat because then the fat will just start to die. But I think a reasonable expectation is you can probably increase the breast volume about 1 cup for each breast for each round of fat grafting. And so if somebody wants a small implant but also wants to use their fat, you can definitely combine those two procedures into one as kind of a hybrid procedure. The benefits would be, yes, you're getting liposuction in another area of your body to contour your curves, and you're also getting larger breasts. Some of the fat will resorb over time, over the first several months. So I tell patients expect that from whatever we start with, probably somewhere between 50 and 75% of that fat is going to remain forever in your breast, but probably some will resorb, and that's normal. So sometimes you do need to do multiple rounds of fat grafting as long as they have a donor site to get the look that a patient's going for. But fat grafting is not going to take someone from like a B to a double D. It just doesn't work that way. About one cup size is a pretty good estimate of what you can achieve with a full round of fat grafting. Let's see. Someone has fat to donate. Thank you so much. Well, that's a good time. Perhaps during all the social isolation we're doing right now, people will just be eating more and storing up their fat to use in their breasts for later after all of this. But yeah, unfortunately, you can't donate to other people. That's a common question that we get. How do we help people choose the right size? So we were talking about the consultation process a few minutes ago, but kind of just to summarize that for newer people to the to the feed. So in our consultation, I personally will do a full physical exam on the patient, which includes taking full breast measurements. Most patients don't realize their breasts have so many measurements that can be taken, but I will go through all of them with you. We use those measurements to start the process of picking the right implant. Then we also use a 3D simulation software package on the iPad that we showed before. We scan the patients in, and then I'm able to virtually simulate what size implants how they would look on them. And then we use our sizing implants that are shaped more like an actual breast, and patients put those inside of a sizing bra, and they put their own clothing on top of that to see how they would look in the mirror. In between those three things, we get a really accurate picture of what a patient's looking for. And sometimes what a patient's looking for is not realistic, and I have to be honest and tell them, look, this is what you're trying to go for. I don't think I can offer that for you, either because it's not safe to do for your skin, or I just can't get that much volume inside of your tissue, inside of your breast at one time. And I would much rather know that beforehand, that I'm not going to be able to satisfy the patient, than afterwards when they're unhappy that I didn't give them the size or the shape they were looking for. So it really helps get everyone on the same page as far as what's possible and what's not. Can you breastfeed with implants? So the answer is definitely yes. My little preamble to breastfeeding after breast surgery is that anytime you do any surgery on the breast, whether you are making it bigger, making it smaller, doing a lift, anytime you start cutting on the breast tissue, I tell patients you're going to increase the likelihood that you may have to supplement your breastfeeding with formula. So when you're getting into more involved types of breast surgery, yes, you're going to be cutting through milk ducts at some point. It goes without saying, but probably not all of them. So there's no reason once someone's healed up from surgery, they can't try breastfeeding. There's a large percentage of women that aren't able to successfully breastfeed, and they've never had breast surgery. Even they might be able to breastfeed their first child, and the second one it doesn't work out, but they never had surgery. So they have to supplement anyway. And so I don't know for any particular patient which side of that you'd be on. If maybe you had to supplement anyway and you had surgery and you still have to supplement. So that's kind of my thoughts on it. There's no reason that any patient can't try to breastfeed. It's definitely possible. Let's see. Does the surgery include support garments to go home with after surgery? Yeah, for most for most types of lifting or more complicated or involved breast surgeries, patients go home in kind of a post-op bra. For breast augmentation alone, I might be different than some, but I'm sure there's a lot. I don't send my patients home in anything after a breast augmentation. You have your little steri strips or your little band-aids under the incision to cover it up, but I don't send them home in any compression, no bras. I just let gravity do its job. For afterwards, I recommend patients can wear nothing if they want to recover. They can wear a tank top. They can wear a top with some built-in padding. But I don't have any type of unique compression or support garments for the first couple months. I would rather just have the implant settle down into place. and they all get there. So, some of these compression devices can be pretty uncomfortable on the breast, especially under the muscle. And so I just don't see a need for them for any type of recovery. But for the other ones that have more scars on the breast, like a lift or reduction or a lift with implants, I typically do send patients home with a soft bra just to help hold the dressings in place and provide a little support. How often do patients typically need, if ever, to have a breast lift and or lift redone? So patients that are usually better candidates for needing a lift with implants or a lift or a potential lift redone is usually after childbearing years. So once a patient has had several children and breastfed potentially, the breasts engorge or they become larger with pregnancy and breastfeeding, then they deflate. And then if you have multiple children or pregnancies, that same cycle happens multiple times. And at the end of the day, when you're done, the breast can be pretty deflated and potentially a little bit low. So those are good patients to potentially combine a lift with implants if the nipple position is low after all of that. If you need to have a lift redone, so as we were saying before, as you age, the skin is still going to lose elasticity. You're still going to get descent to the tissues. And so you would know that you need a lift when the nipple is no longer, on either on the center of the implant, or it looks like it's kind of like this would be like a good nipple position. If it's kind of more riding down here, that might be time to consider having a lift to pull things back up. But a lot of it is personal preference. What I consider to be good nipple position doesn't necessarily mean that it's that way for everybody. If you're happy with it and you like the way that you look, don't have surgery, because they're your breasts. You have to be the one that goes home with them. But I can obviously offer my impression and my advice. Scarring, do we provide any type of scar treatments? Yes, good question. So all of our surgeries in my practice, whether it's for face, breast, body, it doesn't matter. Everyone comes with, all the procedures include scar treatment. We know this is an important topic for many women or many patients, men too. And so as a result, we just include it. And so the type of scar treatment that I typically recommend and give to patients is silicone gel. The product itself is called Biocorneum. Silicone gel is effective in reducing redness and helping to flatten scars as they heal. Silicone is one of the few things that's actually been shown to improve the appearance of scars. There's a lot of products out there, Mederma, Scaraway, there's lots of stuff you can buy. There's very little real scientific evidence for some of these products. There's a lot of anecdotal evidence, meaning that, maybe your friend used it or your cousin used it and they got a good result, but that doesn't mean that there's anything behind it. They just happen to have a scar that healed well. Silicone actually has some science behind it. Oh, hey, Wendy, nice to see you here. Thanks for joining. Silicone actually happens to have some science behind it in hydrating scars to lock in moisture and helping them reduce redness and flatten better. So we include that. I typically give it to patients at their 1 week follow-up and recommend they use it twice a day for 3 months. It also has SPF 30 built into it, which is good if the area happens to be in a sun exposed spot. Mostly for the face, it comes in benefit. Breast and body stuff, most people aren't tanning in the nude immediately post-op, but I guess if you were, you'd be protected in those areas. But I don't recommend exposing scars to a lot of UV sunlight anyway, because that can permanently darken scars as they're maturing. So that wouldn't be advisable anyway. How many surgeries do you typically do in a day? Oh gosh, that highly varies. So if they're short surgeries, like breast augmentation, you can do a whole bunch in a day. You could do 4 or 5 surgeries in a day. If they're longer procedures, like full mommy makeovers or some facial rejuvenation type of procedures, I may only do 1 starting in the morning. And if it's a longer procedure, might finish in the early afternoon, and that could be it. I do get tired too, to be honest. And so it's important that I don't, overly exhaust myself or become too fatigued as a surgeon, so I can keep my focus and do what's safest for the patient. So some days, if that's what it is, I'll do 1 surgery and then go home and rest to get ready for the next day. But really good question. Let's see. So that kind of covers some of the lift stuff. Again, we could talk for a whole hour just on breast lift with implants, because that's a big topic about the pros and cons of that. What other questions? We've been going for almost an hour, so I don't want to introduce any new topics at this point, because this has been a great live session. Anyone have any kind of last minute questions just about silicone versus saline? These are the topics we've covered today: silicone versus saline, smooth versus textured, what the consultation process is like, how we do sizing in the office, how long after surgery can I work out is a question. we can review that. So I typically tell patients to refrain from upper body workouts for about 4 weeks after any breast surgery, whether it's with implants or a lift or reduction. I think your body just needs about that long before you start working out those muscle groups again, or just even just moving your arms a lot like this. Even if it's a lift, you're still creating swelling in the area by being more active. And if you just give it that first 4 weeks, in my opinion, you will do better in the long run and recover much faster. Good. I think that was a great session for today. I hope everyone kind of learned something about breast implants and the consultation process and some of the pros and cons. Of course, we're happy to talk to you more in person about any of these things. Right now, we're doing telemedicine consults. So we can definitely talk in person and do your virtual simulations. But as far as in-person stuff, we have to wait to do that until we're back in the swing of things, with coronavirus being a thing of the past, hopefully very soon, so we can see all of you again in our office in person. But I think that'll wrap it up for today. If you have questions, you can send us direct messages. You can email me. Thank you. I'm glad you found this helpful. We hope that's the point of these little live Q&As, is that you get some information about procedures you may not have known before. And we hope to see you all very soon. So thank you so much, and take care. Nice.
Good job. It's so delayed.
Really?
Uh-huh. It's very